Okay, Ken, I'm going to do a quick review on the impulse just so that you kind of have just a refresher on how to use it. The biggest thing with the impulse is making sure the line of drive is correct. When you have the line of drive correct, then it seems to the impulse works very well. So when you get it out of the cage here, I have it on a foot switch, so you just have to step on this. You'll hear it power up. You'll see the yellow light. That means we're ready to roll. You got the 3 settings: 1, 2, and 3. 1 I usually use for the neck. 2 I usually use for the rest of the back. If you have someone who's really, really large, pushing 300 pounds, then you can use 3, but I rarely use 3 on patients. And if you remember that there's a tissue slack indicator here, so when you push down, when it turns green, from yellow to green, then you know you've got sufficient pressure to get through the tissue slack. So again, it's all about the correct angle. So usually when I'm adjusting, and I find the PSIS, I'll adjust down here in the PIIS, right about that area. So line of drive is usually up and toward the middle of the back. So that'd be my line of drive there. And then I usually do another couple here, do one here, and I'll do another one here. And then when I come in here, actually my line of drive is actually almost straight downward, just at a little bit of an angle when I get to L5 S1. So my line of drive is here. Sometimes I'll do right on top of the iliac crest on each side, but you'll see that I'm pointing inferiorly for those. And then I actually come in here in the SI joint, and I'll go in here, and I'll go in here. So this is kind of the area that I'll do. So I usually do here, I usually do here, I usually do here, I do here, then I do here, here, and then sometimes here, and then here. And then as I'm going up through the back, if I find any spots that I want to adjust, then usually my line of drive is inferior and medial. So then I would adjust, in here like this area here. And then as I work my way up, then I pretty much stay straight up and down in the thoracic, maybe a little bit of lateral to medial angle, if you can see that. So the thoracic more like this. When I get up to the cervical spine, if C1 needs to be adjusted, I'm going to go straight lateral on C1, and then if I do the suboccipitals, I'll go right up underneath the suboccipitals at a very inferior to inferior drive, almost line of drive, almost straight up. And then when I start working on the cervical spine, I have an angle that's posterior to anterior and inferior to superior, like this, as I work my way through here. So this is the line of drive here for the thoracic spine. I'm sorry, the cervical spine. And then the other thing I do, it's hard to do one-handed, but when I do the thoracic spine, I'll engage the tissue slack with my hand. So I'll pull back and do the tissue slack. I'll do the tissue slack for the instrument, because otherwise if you push on the neck and try to get the tissue slack out in the neck, that's quite a bit of pressure, and that's usually uncomfortable for the patients. So I'll take if I'm holding the device in my right hand, with my left hand I'll engage the tissue slack like this, so that it takes the pressure off of that. So I think that should be it as far as how I go through and how I adjust. And so however you find what needs to be adjusted, that's your technique, strategy, however you do it, no problem. Like I said, the biggest thing is line of drive. So you might notice that if it just goes about 4 times and then it stops, then you just have to adjust your line of drive a little bit. Or if it's going and going and going and going, and all of a sudden it beeps twice. If it beeps twice, it just means that it couldn't get a read on how well the segment adjusted. So what you should get when you adjust, you should get the single beep. So if you get the single beep, then you're good, and you can move on and adjust. So if you get 2 beeps, just adjust again. If you get A single beep, you're good to go. If you get no beep, then you just have to redo your line of drive. All right, I think that should help. I think that should do it. Thanks.